dogs, Bordetella bronchoseptica is a cause of kennel cough, canine infectious tracheobronchitis. This is oftentimes a polymicrobial infection involving a number of viruses, including parainfluenza, influenza, herpes, and canine adenovirus. Kennel cough has an acute onset of clinical signs, which includes a paroxysmal cough. It's a productive cough, so the animals are coughing up material, there's sputum being expectorated, and they can also retch as well. So they're sort of gagging and almost appearing as though they're going to vomit. Dogs have swollen vocal cords, which can result in a really unusual sounding cough, almost has a honk-like character. Kennel cough is usually a self-limiting disease, so typically animals get better on their own. The incubation period is 3 to 10 days, and it's very contagious. So any dogs which are infected need to be isolated so that they do not infect others. I'll put a link above to a video where you can see a dog with kennel cough. You can hear the slightly unusual character of the cough. As well, the dog retches a little bit. Patient history is a really important part of the diagnosis of kennel cough. So particularly a lack of vaccination in the past 6 months and contact with other dogs. In severe cases, these animals are treated with antimicrobials, and supportive therapy is also used. So anti-inflammatory drugs, potentially antitussives, and bronchodilators. I would certainly encourage you to consult a good small animal internal medicine textbook for more details. We have a variety of vaccines available against Bordetella bronchoseptica in dogs, including modified live vaccines, which are administered intranasally, whole cell and antigen extract vaccines, which we give subcutaneously, modified live vaccines, other ones which are given orally, and also vaccines for other respiratory pathogens, which can help to reduce the severity of kennel cough in a dog who's infected. So our combination DA2PP vaccine includes canine parainfluenza virus. So with all of these choices of vaccine, how do you know which one to give, intranasal, oral, or sub-Q? In dogs, clinically inapparent infections are very, very common. Serological evidence suggests that there is widespread exposure to Bordetella bronchoseptica among dogs, and it may play a role in chronic respiratory tract infections, so it may be somewhat underrecognized. In cats, we see disease less commonly than we do with dogs, but when we do see infected cats, it may be associated with contact with infected dogs, so the cat picks it up from the dog. Clinical signs in animals who have active disease include sneezing, mucopurulent nasal and ocular discharge, and it's oftentimes quite mild compared to what we see in canines. Cough is interestingly quite uncommon, so not really kennel cough in cats. In young animals, we can see much more severe disease, so pneumonia in young kittens, and these infections can be treated with antimicrobials. Probably doxycycline is going to be the treatment of choice. Bordetella bronchoseptica can also cause infections in rabbits. And just like in pigs, we see similar diseases in rabbits caused by Bordetella bronchoseptica and Pasteurella multocida. So rhinitis, pneumonia, otitis media interna, sort of this Snuffles-like constellation of syndromes. Bordetella bronchoseptica is very common in rabbits with respiratory disease. There was one study in the UK and France which found Bordetella bronchoseptica in 50% of rabbits with upper respiratory tract infections. So if you find yourself working with exotics or pocket pets, this is definitely an organism that you're going to encounter. I've put a link to a video above where you can see a rabbit circling. This animal has neurological signs, probably associated with an otitis media or interna. Guinea pigs are perhaps the most susceptible animal species to Bordetella infections. It's much more likely to result in a serious disease rather than the carrier state. So we don't tend to see healthy carrier animals as much among guinea pigs. It's an acute, rapidly progressive respiratory infection with a high mortality rate, and rabbits have been shown to serve as a reservoir for more susceptible species like guinea pigs. So perhaps in pet store settings or people who have multiple animals, this could be an issue. In people, Bordetella pertussis causes whooping cough. Whooping cough is really a disease of children, and it's a disease that occurs in 3 phases. So starting off in the prodromal phase, we have a sort of cold or flu-like illness. We then move into the paroxysmal phase, 1 to 2 weeks after the prodromal phase, where we have paroxysmal coughing. So the child coughs so intensely and so many times in a row that they actually can't breathe. And these coughing paroxysms are followed by desperate gasps for air. This gasping in for air can be associated with sort of a high-pitched whooping sound, which is where the name comes from. And these paroxysms can be followed by cyanosis, so they can turn blue, or they can even vomit. After the paroxysmal phase, we can get a convalescent phase within about 4 weeks of initial onset, where we see decreased occurrence of coughing, so it gradually gets better. In adults, we can see atypical pertussis. This is thought to be relatively common in university students and also military personnel, so people who live in high-density settings. And interestingly, it's been found in up to 25% of adults with a cough of greater than 6 days duration, so probably also underrecognized. Globally, Bordetella pertussis is associated with 350,000 deaths a year, so it is an important condition. And just like in our veterinary species, it is highly contagious. So greater than 90% of unvaccinated individuals who have significant exposure are going to get sick. Vaccines are, of course, available. We have a highly effective pertussis toxoid vaccine that greatly reduces the impact of this organism. As far as samples to collect, for Taylorella equigenitalis, swabs or biopsies. From the mare, you want to collect those swabs of the cervix, the uterus, or the clitoral fossa. And from stallions, the urethra, the urethral fossa, and the prepuce. These are really delicate bacteria, and so careful sample handling is critical. You really do not want to disinfect the tissues before collection. You can really kill the organism quite easily. And you also want to collect the samples before antimicrobials are administered. False negative cultures are a really big challenge. For Bordetella species, nasal or tracheal swabs, you do not want to use cotton swabs for Bordetella. Cotton can actually be toxic to these organisms and reduce the likelihood that you'll get a positive culture. We can collect samples by either bronchoalveolar lavage or transtracheal wash, and transport media is very important. You need to use a sample collection device that's going to keep that bug happy and moist and protected from the environment. And of course, do not freeze the samples if you want to culture them. Once in the lab, Taylorella absolutely can be cultured, although identifying it can be a bit of a challenge. It may not be well identified by MALDI-TOF, and so PCR is often done on either pure cultures or directly from clinical samples. For Bordetella, culture is certainly possible. We can use blood agar or centromide agar. This is a selective media. Serology and fluorescent antibody tests on tissue sections are also widely done. Taylorella is really not a zoonotic concern. It doesn't really transmit very well between species. It's primarily associated with horses and equids. Bordetella species, on the other hand, have a very broad host range and should all be considered potentially zoonotic, although we have insufficient evidence to really quantify exactly how big the risk is with each species that we encounter in veterinary medicine. Bordetella bronchoseptica has been isolated from respiratory submissions, from people that have a whooping cough-like illness, so it may cause something very similar, and these infections are presumed to be zoonotic. Bordetella bronchoseptica can be pathogenic in immunocompromised individuals, so children, chronic alcoholics, people with AIDS, acute leukemia, cystic fibrosis, bone marrow transplants, so are sort of debilitated and vulnerable populations. This is a figure from a recent study documenting zoonotic transmission of a vaccine-derived Bordetella bronchoseptica, so in one of those modified live vaccines, to an immunocompromised individual. So really important to mention, This patient was receiving TNF-alpha inhibitors, which is going to greatly reduce the ability of their immune system to fight off an infection. So not something that would be a high level of risk for the vast majority of the population. To summarize what they found, the dog was vaccinated at time 0 back here. Little over 3 weeks later, the owner developed some clinical signs, some coughing. The organism was identified by PCR and was also cultured within about 6 weeks. The authors of this study didn't draw any conclusions about how commonly these infections occur, but rather just wanted to raise the possibility of Bordetella bronchoseptica infections associated with modified live vaccines in immunocompromised individuals. So raising awareness was really their goal. Other incidents of zoonotic or interspecies transmission have absolutely been reported. So in this first case here, we have human Bordetella bronchoseptica infection related to contact with a rabbit. And in this case report, it wasn't simply coincident infections, but they actually did DNA fingerprinting on those isolates and found that the human and rabbit strains were really indistinguishable, which is pretty good evidence of transmission. And then on the right, we have an example of interspecies transmission not involving people. So Bordetella hinsii is a species which infects poultry and causes a similar disease to Bordetella avium. And in this particular investigation from emerging infectious diseases, they found it in rodents. So with these examples, I think you can appreciate that Bordetella have a potentially broad host range, and we need to be aware of them as potential zoonotic risks or risks to other animal species. For Taylorella infections, we can treat these with antimicrobials to eliminate the carrier state. Many antibiotics are apparently effective, although we don't have any guidelines for conducting or interpreting antimicrobial susceptibility tests. For Bordetella, the susceptibility to drugs varies. Widespread cephalosporin resistance has been reported, and so typically our tetracyclines are the treatment of choice. Just one new term for today, and of course some questions for self-assessment.